Hello, ladies and gentlemen, and welcome again to the DEKA webinar series. Today we're talking about the tips and tricks on how the Moveo is changing the hair removal and pigmented lesion treatment. The official language for both presentation and question is English. The speakers of today will be Professor Paolo Bonan, ESLD Key Officer, EADV Laser Task Force members, Adjunct Professor of Laser Plastic Surgery, University of Siena, in charge of Laser Cutaneous Cosmetic and Plastic Surgery Unit at Villa Donatello Clinic, Florence, Italy. Other speaker will be Dr. Michela Troiano, Dermatologist, Assistant at Laser Cutaneous Cosmetic and Plastic Surgery Unit at Villa Donatello Clinic, Florence. During the webinar, you can send your question by acting on the question function that you find on the screen you have access to this webinar with. The question will be all answered at the end of the webinar and the following days eventually by both the speakers. For questions relating to technical and logistic details instead, the answer will be provided directly by our team. Today, we are introducing Moveo, the most effective, fast, safe, and simple function handpiece that you might find on your both Motus AX and Motus AY. The topics of today will be description of the Motus idea with Moveo handpiece, a brief technical tour about the two devices, Motus AX and AY, the operating parameters and clinical application with before and after pictures and videos, the introduction of the newest Moveo Pigl with pictures and video too, and of course, as usual, a question and answer room at the end of the webinar. So I have the honor now to leave room to Dr. Michela Troiano for the beginning of the webinar. Enjoy it.
So thank you, Simone, for your introduction and welcome to Moveo webinar. Moveo is a revolutionary technology at the beginning introduced by DEKA for photoepilation. Then the field of application has been increased even to the treatment of pigmented disorders. These technologies, this handpiece, it's very unique and special, and it has completely changed the concept of photoepilation because it's a cooled sapphire cylinder tip, which is applied directly in contact with the skin, which is able to convey all the laser energy into the skin, increasing the effectiveness of the treatment and reducing energy leaks to the skin. And despite other devices, it's normally performed making multiple passes in the same area. Well, today we will speak about how and why we arrived to the introduction of these NPs and why this device should be considered the best for photoepilation. You know that the market around photoepilation is huge, but most of the devices you find on the market, they delivers energy through the air before reaching the skin. So because the high difference in refraction index between hair and skin, the portion of reflected energy is more than 50%, and the portion of transmitted energy is less than 50%. So to be effective in our treatment, we need to work with very high fluencies, very high frequency. And so this means the possibility of a painful treatment and the possibility of side effects. So because most of our patients do not come for medical problems, but they come for an aesthetic purpose, if they are not sufficiently motivated and they feel pain, they can discontinue the treatment. So the idea of DEKA was to devise a strategy, was to find a way to work in a painless way with no risk, avoiding side effects. And so this was possible thanks to the introduction of this new handpiece, Moveo. Moveo has a cooled sapphire cylinder tip on the top of the handpiece, and it's able to convey all the laser energy into the skin. So more than 95% of the energy is transmitted, less than 4% is reflected. In this way, we can work with very low fluencies and high frequency to maintain the treatment fast. And in this way, we can increase the effectiveness of a laser treatment, reducing the energy leaks, but in particular, we can work in a painless way. To maintain the effectiveness of our treatment, the procedure is normally performed making several passes in the same area. So this permits to the hair follicle to increase progressively the temperature until it reaches the thermal damage threshold. So it's a painless procedure. We have less risk of pigmentary change, less risk of burns. It's a safe and effective procedure. And the choice of the sapphire cylinder results from the fact that the sapphire cylinder does not deteriorate and hair residues do not become attached during the treatment. The effectiveness of the treatment was also proven by histological examination with hematocillin and eosin, in which we saw after the treatment with Moveo in figure C that we have a coagulative necrosis of the wall hair, so medulla, cortex, and cuticle. This kind of handpiece, you can find this kind of revolutionary handpiece in two different platforms, Motus AX and Motus AY. Both of them have an Alexandrite source, 755 nanometers. Motus AY also has Nd:YAG 1064 nanometers. So both of them can treat hair removal and pigmented lesions, but Motus AY can also increase its field of application with the treatment of vascular lesions, photorejuvenation, and some dermatological disorders such as onychomycosis. There are also traditional handpieces with different sides, and in particular for Motus AY, we have also the 2.5 and the 5 millimeter for vascular treatments. But the key word of this device is no pain, and this is thanks by the fact that we work with very, very low fluence, but we maintain the effect because we proceed to treat several times in the same area until we have reached the dose, we have reached the accumulation rate, we have reached the endpoint of our treatment, which is the appearance of erythema and perifollicular edema. So, I'm sorry. We have a video, and here you can see how the system works inside. So we have a coagulative necrosis, and the hair follicle is not fed anymore. So it leads to, it goes to die. Has most of the devices, there are a lot of contraindication and exclusion criteria. So it's not possible the treatment in patients who are very sensible to lights, patients who had applied perfumes or cosmetics, patients in particular with tattoo or dysplastic nevus or skin cancer in the area of treatment. But the treatment is a pretty safe and pretty simple treatment. So at the beginning, we have to shave completely. Then we have to divide the treatment in square 10 by 10. with a pencil, but it's not necessary. So if you are an expert, it's not necessary to divide, but it's important to consider to treat an area, a square, which is 10 by 10. Then we apply an oil or a gel on the skin. The treatment is pretty easy. Even from not expertise. So we have very few parameters to set. We have affluence, which range from 2 to 8 joules per centimeter square. We have a pulse type, a frequency, and an accumulation rate, which is the amount of energy. Another important is not a parameter, but is a way of work is the speed of the movement, because we don't have to go really fast for the exception of darker when we have to treat darker phototype. So we can proceed with a moderate speed, and if we go slowly, we can observe early the appearance of the erythema and the perifollicular edema. But how we have to set the parameters? Well, the setting of the parameters is pretty simple. So we have affluence to set, which normally range between 2 to 8 joules per centimeter square. So we normally use 6-8 joules per centimeter square for a Fitzpatrick phototype 1, 2, 3, and 3-5 joules per centimeter square for a Fitzpatrick phototype 4, 5, and 6. We have to set a pulse type, so we can work in a soft mode, normal, or high mode. What does it mean? It means the duration of the pulse, 8 milliseconds for the soft mode, and it's normally used for dark and thick hair, or high 3 millisecond pulse time for fair and thick hair. But what is really important to set is the accumulation rate, the amount of energy, which is the dose that I need to irrigate in an area which for convention is 10 by 10, and which at the end of our treatment will permit us to observe the erythema and the perifollicular edema. But what happens when we have to treat an area which is not, in which we cannot perform a square of 10 by 10, but for example, a square of 5 by 5? How can I select my dose? Well, in this case, it's not the half of the previous dose that I selected for a square of 10 by 10, but it will be a quarter of the previous dose. Well, the technique is pretty simple. We can perform the treatment making circular movements or linear movements. And here I have a brief video that show you how we normally perform the treatment. So we have to completely shave, because we don't need the hair to be 1 or 2 centimeters in length, because it's not our intermediate of the light in this case, because we apply it directly in contact with the skin. We have to divide the area in squares 10 by 10. Then we apply an oil or a gel, and we start with circular or linear movements. We proceed passing several times into the same area until we have reached the accumulation rate. So until we have reached the dose, which will be the dose after this irrigation, I will observe the erythema and the perifollicular edema. When the dose is completed, the machine stops itself, and we can work in the closer square. A few words about the material we normally apply on the skin. It's possible the application of an oil or a gel. Personally, I prefer the gel. First, because when we have to treat darker phototype, it's better the use of the gel, because otherwise we can burn the patient. And secondary, because when we have to treat, for example, the inguinal area or the axilla, in which these are a very sensitive area. So in this area, I can use an external cooling system, so the oil could dry very fast. And this not happens when I use the gel. So the endpoint of our treatment will be the perifollicular erythema and edema. What do I have to tell to my patient after the treatment? Well, after 3-4 days, the hair shaved during the treatment begins to grow up. After 15-20 days, the hair starts to fall out until a 40-80% of hair loss is reached. Treatment frequency, well, normally our protocol suggests 6-8 treatments with an interval of 6 weeks. For the treatment of the face, normally we don't exceed the 4 weeks. The treatment is pretty safe, but what is important is to follow the right behavior. So sometimes we had problems with some doctors who didn't perform the treatment in the right way. So first of all, we have to completely shave the patient, because if we leave long hair, so a bad shaving can cause the risk of burnings. We have to work applying the end piece on the skin, so it must be applied in contact, so we don't have to work in a defocused way. We have to be careful when we pass over bony sites. So if the patient feels pain, we have to go faster, and we don't have to insist in this area. We have to move all the time with circular or linear movements, but we don't have to stay still in one point. For darker skin types, the behavior it's really important, because in this kind of patient, first I have to reduce the fluids, I have to reduce the dose, I always have to work in a soft mode. I need a gel and not the oil, because the oil can burn the patient. And sometimes it's not possible to avoid bony areas. So in this case, we have to go very fast and few passes. And if it's possible, use an external cooling system. Well, I've been using this kind of device since 2015, and in this period, I had the possibility to evaluate the right parameters, to evaluate the possible side effects, but what I had, a lot of patients satisfied. So now I would like to show you some of our clinical cases in skin type Fitzpatrick phototype 1, 2, and 3. This is the first patient, the treatment of the axilla with Moveo with affluence of 6 joules per centimeter square. Medium mode accumulation energy 2000 joule, and you see the result after only 2 treatments. Another case, the treatment of the back of a male with affluence of 7 joules per centimeter square in a high mode with an accumulated energy of 2000. I have to confess, he was my KV because he is one of my colleagues, and we treated only the left side. So this digital aspect that you see in the left side is the footprint of the Moveo. So you see, we had a result after 1 treatment session, and the follow-up was performed 5 months after the treatment. This is another case. This is the treatment of the bikini line with affluence of 7 joules per centimeter square with high mode and an accumulated energy of 2,000 joule. This is a funny picture because this patient had this tattoo in the inguinal area. I started to perform the treatment, but I told to the patient that I was afraid to stay too close to the tattoo, and so I left an area of 2 centimeters around the tattoo, and after 1 month and a half she came back with this island of hair. So she said, I don't care about my tattoo, I prefer to remove hair. And so this is the result after 4 total session, but it's important not to go through the tattoo, okay? Now she used to come once a year to maintain the treatment. Another case, another treatment of the bikini line with a fluence of 8 joules on centimeter square. So here you see that I worked with very high parameters. So fluence 8 joules on centimeter square in a high mode with an accumulated energy of 3,000 joule. And this is what happened. So after 1 session treatment, after 1 month and a half, she had these results. And even if I worked with very high parameter, I didn't have any side effects. This is another case of the mental area with the following parameters: 7 joules on centimeter square, 2,500 joule in a high mode. And you see a complete fallout of hair after 1 treatment. And another case, the treatment of the back, only one treatment session. This is not my case, but he had a very good result. Another case of the bikini line, you see the effectiveness of the treatment. This patient performed only 3 sessions, and she had a completely fallout of her hair. This is the back of a male. He used to come once a year before summer. And this is my first and last side effect. Unfortunately, this patient had this tattoo in the inguinal area. I don't know why a lot of patients has tattoo in this area, but I'm sure I didn't go through the tattoo, but maybe there was a sort of scattering phenomenon, and this melted the tattoo. This is another case. Even this patient, she used to come once a year to maintain the treatment. Another case of the axilla after only 1 treatment session. This is the same picture you saw before. And this is another funny picture because in this case, you can see the hair before the treatment, but what you can see after 1 month and a half is this a sort of hair bracelet around the tattoo. We also tried to compare the effect of Moveo and the effect of a traditional end piece, the use of a standard end piece. And what we saw is that the results, they were completely the same. And you see also from here, immediately after the treatment, that we can observe the erythema and the perifollicular edema. Another case of the mental area, you see before and after treatment, this patient was really satisfied because she also said that she had a fallout of white hair. Well, it's not maybe she was happy because she had a fallout of her black hair, because in any case, Alexandrite, you know, it's able to recognize the melanin. So in the white hair, if there is no melanin, it's not possible to have the fallout of this hair. But you see, she had a very good improvement. But we also treat darker phototype. Here we have a Brazilian male. We treated the leg, with a fluence of 6 joules per centimeter square in a soft mode, and with an accumulated energy of 2000 joules. So you see that we need to reduce the fluence. We need to work always in a soft mode. We need to reduce the dose. And here you see that we treated only the left side, because on the other side we have the tattoo, and you see after 1.5 months what happened. Again, the treatment of the chest, only 1 session with Alexandrite. Another case, just to show you that these kind of treatment do not provoke any kind of burns. Another case of the upper lip. You see before and after treatment. This is a funny case because the first time this patient came to my office, she had this blonde hair because she used to dye her hair. And so she also was really afraid to perform a treatment with Alexandrite because she had a very bad experience with Nd:YAG in another office. And so we tried with Moveo. We performed 3 sessions with a fluence between 3 and 5 joules per centimeter square in a soft mode with a dose of 2000 joules. And here you can see the result after 3 treatments. Now this patient used to come twice or 3 times per year. You see the blondie hair and the resolution. Well, with Motus AY, we have also the possibility to shift from Alexandrite to Nd:YAG. So if we are not very confident with Alexandrite and we are afraid to for the risk of side effects, we also can work with Nd:YAG. So when we have to treat with darker phototype, we have to follow a general behavior, and this behavior is really important for darker phototype. So we have to work with very low fluence, reduce the frequency, reduce the dose. It's important to go very fast and apply a gel and not an oil, and if it's possible, to work with an external cooling system. Well, Alexandrite, it's able to recognize the melanin, which is inside the follicle, but it's also able to recognize the melanin of the skin. So that's why DEKA introduced another end-piece, which is Moveo Pigl, and which is able to treat pigmented lesions. In this case, the end-piece is 7 millimeter in size, and it can go up to 30 joules on centimeter square. Instead, traditional Moveo for photoepilation reach 8 joules on centimeter square. The treatment is pretty simple and safe. Here you can see the parameters that we normally use. We have to remove the makeup, lotions, and deodorant. Cover any eventually dysplastic or in general nevus. And at this point, we have to set the parameters. Also, in this case, we have to work performing the treatment in a square 10 by 10. The fluence is normally around 18 joules per centimeter square. We work in a high mode with a dose of 2,500, 3,500 using a gel, a transparent gel. Also, in this case, we can perform the treatment making circular or linear movements. And here is the comparison with another source, Q-switch. you see the difference, what happens step by step. With a Q-switch laser, normally we have immediately after popcorn appearance, then we have these purple spots, then we have the creation of adherent cross that then they fall out, and we have a complete healing of the skin after 30 days. Moveo is more similar to Pig.L because immediately after the treatment, the spots become darker, and then there is the creation of very, very thin and adherent black crust. After 10-15 days, they fall out, and we have possible disappearance of the spots. Some of the spots remain, so we need to perform another session treatment. Here I have some clinical cases in Caucasian patient. This is one of our first treatment. You see immediately after the spots become darker, and you see the erythema in the area treated. These are the parameters: 25 joules per centimeter square in a soft mode with a dose of 3000 joules, a frequency 3 Hz. After the day after, you can observe an important erythema, and you can observe the appearance of these adherent and black crust on the top of the spot. Then they fall out, and after 8-10 days, we have a completely healing. So as you can see from this picture, we have a lightening of the skin in general, and so after 1 month, the four spots that are circled, they disappeared, but some others remain. So we need to perform another session treatment. So normally it can be rescheduled after 20 days. Again, you can see that even if the spot did not disappear, we had a discoloration of the spot. And here you see after 30 days. Again, before and after treatment, you see the disappearance. Maybe we need to perform another session treatment. And this is what we can observe step by step. The day after, you see the erythema, you see the appearance of these black and adherent crust. Then they fall out after 9-10 days. After 18 days, we have the disappearance and the healing of the skin. And here there is a video. So this is the treatment of the hands. You see the treatment is pretty simple. We have to treat an area which is 10 by 10 with the following parameter: fluence 25 joules per centimeter square, 3 Hz, soft mode with an energy dose of 3000 joules. Even when we have to treat a single spot, we can perform the treatment, continue to pass over the square of 10 by 10. And this is really important because it permits us to reduce a possible chromatic contrast between the skin in which we had the spot and the healing skin all around. So you see, even after this treatment, we had a discoloration of the spot. So we need to proceed with another session that can be rescheduled after 3-4 weeks. Again, same parameters: fluence 18 joules per centimeter square, high mode frequency 5 Hz, 2500, 3500 joule as dose. You see after a progressively discoloration of these spots. This is another case. In this patient, we treated the face, and we also treated the hands. Immediately after the treatment, we observe this erythema, this important erythema. So we need to apply high spec. After 7 days, this patient had these results. So she had this very thin and adherent crust and black crust, but she also had this blister because maybe I insisted too much in a bony site. So be careful when we have to treat bony sites. And this is the result after the treatment. You see before and after with the 3D imaging system quantifier. And again, before and after, so the skin is clear. Again, the treatment of the face. So also in this case, we have to treat an area which is 10 by 10 for convention. We continue to pass in the same area until we have reached the dose that we have previously selected. But you can see the patient is fine. It doesn't feel burns. She can feel a mild heating. This is the treatment of the décolleté area. Immediately after the treatment, you can observe that the spots become darker and we have the erythema. After 25 hours, the erythema is important and we have this black-brown adherent and thin crust. Another video. The treatment of the décolleté area. Surely we have to divide in square 10 by 10. Then we perform the treatment, passing several times into this area until we have reached the dose. Then we can pass to the closer area. Immediately after the treatment, the spots become darker. And after 2 weeks, the skin, the spots are lighter, and the skin in general is lighter. This is another case, the treatment of the face with the following parameters: fluence 25 joules per centimeter square, 3 Hz in a high mode, and with a dose of 2,500, 3,000 joules. And here you can see we had an improvement of this pigmentation. Again, before and after treatment, the left side, before and after treatment. Same patient, she also had this pigmentation around the scar. So after only one treatment session, she had this result with a discoloration of the pigmentation. This treatment can be performed even in Asian skin types. So we have some clinical cases from Korea. So these are not my cases, but the treatment is the same. So we need to perform the square 10 by 10. The parameters are pretty the same. So fluence of 20 joules per centimeter square in a high mode, 3,000 joule, and 3 Hz as frequency. Even in this case, you can observe resolution of some spots, some other remain, so we need to perform another session. So another case, before and after treatment. Even in this case, we had a completely discoloration of the spots with no burns, no side effects. In this case, we need to perform another session treatment. And here you can see step by step what happened. So immediately after the treatment, the pigmentation becomes darker, even in Asian patients. Then we have the day after the erythema and the creation of this adherent and very thin crust. Then this crust fall out after a week. And after 10 days, we have a resolution of the pigmentation. Some pigmentation remains, so we need to perform another treatment session. You see, 10 days after, we have, in any case, a discoloration of the spots and all the whole skin in general. Another case, you see the treatment of a male immediately after the appearance of the erythema and the spots that become darker. Then we have the creation of this cross and the erythema. It's really important. Then the cross, they fall out after 8-10 days. The left side, you see again how is important the crust and the erythema the day after, but the patient can cover with a makeup. Again, you see the disappearance of the spots after 8 days. Another case, the treatment of the spot on the cheek. So after the treatment, the erythema and the spot that become after 8 days, we have the complete disappearance of the spot. Another case of the left and right side. This patient was treated with affluence of 26 joules on centimeter square, 3 years in a high mode with an accumulation energy of 3,000 joule. You see what happens the day after the erythema, the spot that becomes darker. And after 10-15 days, we have the complete disappearance of the spot. So our endpoint will be the darkening of the lesion. After this, we have the day after, we will observe the erythema, we will observe this adhering crust, then they fall out after about 10 days. And after 15-20 days, we have a discoloration of the spots, but even the disappearance, we can reschedule the treatment after 3-4 weeks. We normally apply high spec, and eventually we can suggest the patient to apply antibiotic creams. It's also possible to treat pigmented lesions even with the standard NPs. In this case, the technique is pretty simple. We have to apply the spacer on the skin. So we proceed making a shot-by-shot technique in order to cover all the lesion up. It's important to stay focal, so not defocal the NPs. Also in this case, we can reschedule the treatment after 4 weeks. So my session is concluded. Thank you for your attention.
Thank you, Dr. Michela Troiano, for the very interesting, exhaustive, and full of clinical details presentation. We had a wonderful chance to see how the Motus AX and Motus AY completed by the Moveo PL handpiece are working on different and several skin types. Now we are actually going to getting ahead with the webinar. We are about to start with part 2. introducing to you Dr. Paolo Bonan, that is getting video connection in this moment.
Well, good afternoon, everyone, and welcome back to those fellow physicians who were with us last week.
Sir, we're not seeing you in this moment.
Why not?
There we go. So I'll leave room.
Okay.
I'll leave room to Professor Paolo Bonan for the continuation of the webinar.
Well, again, good afternoon, everyone, and welcome back to those fellow physicians who were with us last week for the first webinar, and a warm welcome to the participants who are with us, who have joined us today for the first time. Last week, we have a look at the DEKA suite of DEKA CO2 laser platform smart site in the treatment of various cutaneous conditions like seborrheic keratosis, dermal nevi, rhinophyma, sebaceous nevi, and autoimmune disorders, premalignancies, and even wrinkles. Today's webinar focus is instead on Motus AY and Motus AX and Motus Pigmented. Before delving into the core of the second part of the webinar, let me remind you and urge you, fellow physician, to actively participate by writing down your comment or your questions. Even today, we have Simone Parenti, the moderator, that will help you with the questions. I have to thank Simone because, as we said, he burned the midnight oil. Is the great job he have done up to now. And so at the end of the webinar, in question and answer session will be taken. Let me mention and thanks once again, Dr. Paolo Salvadeo, Dr. Giustino Gallo, area managers, collaborators, friends, and the marketing manager in charge, Irene Bini, and the Congress coordinator, Joanna Norgren, and even the thanks to Vincenzo Di Meolo for his crucial and very important support. Without further ado, let's start with the second part of the webinar. And this part is moving on. Some technical problem in moving the presentation. Only one problem. Well, the second part is on the vascular treatment. In Motus AY, we have an important source that is one of the most important sources at our disposal, Nd:YAG laser. If you see here in the graph, in this line, you can see the fourth peak of absorption by hemoglobin. It's very important. So allow us to understand why we can treat the vascular network with the Nd:YAG. Nd:YAG is present only in the Motus AY. There is a great absorption by hemoglobin that is the chromophore for the vascular tissues. Well, let me mention briefly to the classification, because we have to know the physics of our laser, but even the substrate where we are going to plan our treatment. Vascular anomalies are divided in two subsets. And the first is the tumors or hyperplasia on the left, and on the right, you can see the malformations. In the first group, we have hemangiomas. Hemangioma is very commonly met because we treat sometimes with the different procedures and different protocols. With the laser, we can treat only the superficial hemangiomas. And now we are going to understand what we have to do, what we must avoid in treating the two lesions in the different groups. We have two main systems, the DEKA products and equipments. The Motus AY, as I said, with the Nd:YAG laser source, and in the right, you see SynchroVascu with the pulse dye laser as a laser. Hemangiomas, they are characterized by incidence of 5 to 10% more in the premature, growth without regression, So in the past, the behavior was to wait the natural regression. Now we have to treat as soon as possible, as we'll see later on in the next slide. The clinical is a very superficial pink pale blue lesion or bluish mass or lesion similar to hematoma, mass with the greater dimensions. But what is important, the presence of endothelial hyperplasia. Why is important? Because we understand that the Nd:YAG laser is important, laser of choice for that, because Nd:YAG of Motus AY has the characteristic to penetrate, to diffuse in the tissue with the so-called scattering effect. So you can involve a mass of endothelial cells. Now we treat as soon as possible hemangiomas because we have to avoid the atrophic, hypertrophic tisular outcomes. This is an example, it's a patient of mine, and you see the parameters on the left with the spot size 5 or 10 millimeter, number of pulses 2, pulse length is 5 and 15, the first and the second subpulse with a delay of 10 milliseconds, fluence at 10 joule per square centimeter, and repetition, a single shot. Why it's important to treat as soon? Because if this patient had been treated when she was 5 or 6 or 4, we would have better results. You still see a very modest bed scarring, even though we improve the hemangiomas. The same with this contribution of my friend Jean-Luc Lévy. You can see here the remaining scar is a little bit atrophic. But in this patient, 6 years old girl, you can see with the same parameters that I showed and suggested before, that we still see the apparently normal scale in the middle, in the center of the lesion that we treated, that is quite similar to the skin in the contiguous areas. Is the detail. Well, another 5 years old, you see before and after, flattened and completely improved the lesion, only a modest pigmentation because the picture was taken in the follow-up after summer, but the pigmentation disappeared in a couple of months. 4 years old, you see perfect restoration of the texture, same parameters. Newborn, perfect results, no bed scarring, same parameters. And this is a very particular localization, indicates how we can be selective with this kind of laser, because we can hit and selectively only the red lesion with hemoglobin for the great affinity with this kind of chromophore, even in this delicate area of the lower lip. Well, the other group is the group of malformations where we can find the Portwine stain. Is a venular malformation. The incidence is lower, is 0.3%, and is characterized by growth without regression. So we have to treat it's important to treat very soon. Why? Because we risk to have a thicker lesion as the time goes on. It's characterized by presence of numerous ectatic vessels in the papillary and reticular dermis. Again, it's crucial to evaluate the histology. Why? Because this dilated vessel indicates that the laser of choice must be another one, pulse dye laser. Pulse dye laser has a great affinity for the chromophore. And this dilated vessel, if we treat with Nd:YAG laser, we risk to have an atrophy. This kind of malformation is present in combined complex malformation like Sturge-Weber, Klippel-Trenaunay, Proteus, Parkes-Weber, and von Lippen-Lindau, and other complex diseases. This is an example. The laser of choice is pulse dye laser because there is a great selectivity, great affinity. We can use Nd:YAG, but only for treating the tuberosities, the nodules that rise up during the lifetime. And in another area, that is the upper lip, where we have a sort of spongious tissue and we need to penetrate a lot, as we can do with the Nd:YAG. These are the parameters. You can see here the parameters that we use with the Synchro-Vascu, with the Pig.L. Spot size from 10 to 12 millimeters, one pulse with a length of 500 microns seconds, and effluents ranging from 6.5 and 7 joule per square centimeter, sometimes 8 or 9 joule per square centimeter. Only one passes, and there is an interval between the session of 1 month and a half or 2 months. Well, with Nd:YAG, for treating the nodules, we use the same parameters that we suggested in the other hemangiomas pictures that I showed so far. Telangiectasias are extremely fine varicose veins with a gauge of between 0.1 and 1.5 millimeter. We have different clinical evidences and appearances, simple arborized, arachnoid and papules, but the procedure is the same. And we have to highlight these two important concepts, that facial telangiectasias do not generally show great difficulties, so they can be safely treated with several types of lasers. On the contrary, lower lip telangiectasias create problems, especially in the choice of the approaching mode. Facial, you see spider nevus before and after the treatment. Only one session, good results. You see the mechanism of action with a dermatoscopical image. We can appreciate that you break the vessel wall thanks to the extension of the theory of photothermolysis, selective photothermolysis, because we involve after the hemoglobin even the vessel wall. So we can break, and we have a vasospasm, and you can see the picture after the treatment. And the endpoint clinically is represented by a sort of erythema and modest edema. The parameters. The first pulse is 5, second around 20 or 17 milliseconds, with a delay of 20 or 17 milliseconds. Spot size 5, 2 pulses, 2 subpulses. The effluence is ranging from 95 to 100 joule per square centimeter and single shot. Normally one session is enough. Depends on the extension of the telangiectasias in the face. We can have another appearance of post-treatment results. Immediately after, we can have a sort of darkening of the vessel, because especially in the larger vessel, we can have a sort of intravascular coagulation. So the result is a bluish color, but both of them lead to the same results, the disappearance of the vessel. This is a complex case where we had a very large network of dilated vessels, and you see in after the first treatment, second treatment, third treatment, and 3 months post-op. These are the two modalities how we can take the picture. In the lateral side, we can see the polarized light that is capable to evidence the vascular network and normalize in the center of the slide. And you see before and after the good clinical results after 3 treatments. This is the detail. You can appreciate the total disappearance of the vessel. Well, this is a video, and in this video you can see 2 important things. With the green light, we can follow the track of the vessel, and you will see at the very beginning the disappearance, so the vasospasm of the vessel. You see the blanching. I hope that you can see this evident phenomenon, and after you will see the bluish color as a response. You see, so 2 different modalities that lead to the same results: disappearance of the vessel. Well, this is a very particular case where we have the rare combination of portwine stain and hemangiomas. We use in the combination of in a synergistic use pulse dye and Nd:YAG laser. With the first, we use a portwine stain for treating. We use the pulse dye for treating portwine stain, and then after the improvement of this part of the lesion, we can use Nd:YAG for treating the hemangioma, the little hemangiomas in the lateral canthus of the eyelid. Well, now it's very important to highlight the mistakes, in particular my mistakes, because it's important to report back to you not only the brilliant results that we are used to do in the congresses. Today, I want to share even with you my mistakes that I have done in the 3 decades that I use laser systems. You see the crusting running along the vessel is due to the 2 causes. First, if I want to use 5mm spot size, I need to cool down the skin and move slowly the end piece. Why? Because when we use, you see the comparison between the 2 spot size in this split phase study. If we use on the left the 2.5, we have a very superficial heating of the skin and the vessel. So you can get good results, but you are very superficial, and so is we have less risk of side effects. On the right, immediately after the treatment, by using the 5mm, we only have a modest erythema. So it's more professional. My suggestion is to use 5 because you can go out after the treatment without any important signs or crusting and scabs. But both of them lead to the same results. Taking in mind that it's very important to cool down the skin in order to avoid to cook the skin if you use 5mm, because you are heating a large amount of tissue. Leg vessel. Well, there is a clear demand for laser irradiation of face and leg telangiectasias, but in the laser treatment of leg telangiectasias, there can be small vessel too technical challenging for sclerotherapy, vessels resistant to sclerotherapy, or tendency to telangiectatic matting. In reality, sclerotherapy and laser are not necessarily alternative, but rather complementary procedures. You have to pay attention in the legs to the hemodynamic, because the hemodynamic lead us to the opportune strategy, the proper strategy. Because we are sure that on the left, we don't treat with the laser the patient that you can see with the varicose veins, but we are not sure to treat even the telangiectasias on the right side of the slides. Why? Because we need the opportune protocol of study of the patient with the telangiectasias. 3 steps of this study. echo-Doppler exam of the veins in the lower limbs, direct ultrasound exam of telangiectasias, clinical evaluation. Venous system is very important to understand that if you have a problem like that, we have a very superficial telangiectasias, you see the square, white square with the T, and with our superficial telangiectasia, but we have problems in the deep femoral system with a squeezing test and Valsalva maneuver positive. We must not treat directly with the laser. Second, the problem is at Safena system level. No direct treatment with the laser. Third case, we don't have any problem in the depth, so we can treat directly. In summary, in the first two cases, we need to carry out a surgery or sclerosis. In the third case, we can perform directly the laser treatment. Well, before executing our laser treatment, it's very important to carry out even an ultrasound exam. Why? Because we can have, you see in red, our telangiectasia running in the superficial part of the skin, but even a mother vessel that can feed this telangiectasia. So we need the sclerotherapy before 1 month, 2 months before the laser treatment, then the finissage with the laser. But we need the third step of protocol study. This one. You see this a sort of upside down tree where we have the mother vessel up, and in the bottom you see the branches of telangiectasias. In this case, it's opportune to carry out the sclerotherapy. But we have a second case where if it's completely wrong to execute the sclerosis before starting with the laser. Why? Because we risk a persistent macking. In fact, in the first case, the sclerosis of the venule has stopped the leakage point, but in the second case, the sclerosis of the venule has stopped the drainage pathway. So we risk to have a matting in this case. Well, the laser, we have to pay attention to all the parameters and the laser tissue interaction features. You have to keep in mind that we are in front of a chromophore movement. And now, after this important part we highlighted, we are sure that we cannot treat this patient. We can treat this patient only after the protocol of study to use the laser at its best. Even in this case, we can see the endpoint, the erythema and the edema, and the typical image is this before the treatment with the two modalities of the light, polarized and normal light, and you see immediately after, you have the arched or snake-like geographical running erythema and swelling that we can have is exactly how it should be. This is the dermatoscopical image, and we have here a video that show us how it's very interesting and even astonishing to follow this kind of treatment, because you see immediately the disappearance, the vasospasm of the laser, of the vessel treated with the laser. You see the disappearance immediately after the heating with the laser. In the area that we treat, we are able to reduce or to eliminate with a vasospasm the telangiectasia. Very, very satisfying for us and for the patient. The compliance of the patient is, of course, very, very high. We need normally to treat in the same area, sometimes 1, 2, or 3 times, but we need at least 2 months of interval apart between the session in the same area. You see here the steps after the treatment, before, immediately after, 1 week after, 2 weeks, and 1 month post-op. And you see the patient 1 month and 2 months out. You see the nevus indicates the reference point indicates that we are in the same area we treated. Possible complications. The more common is the hyperpigmentation. The other ones are very rare now. You have only to make a great mistake in using the non-proper parameters. But the very, very common is the pigmentations. Why we can have this pigmentation? Because you go to the sun immediately after the treatment, you use too much energy, and you don't use the cooling system for cooling down the skin. Well, onychomycosis is very interesting because it allows us to treat the patient that are resistant to the oral antimycotic drugs. And I accept these images by the thesis of another member, important member with Michela Troiano of my staff, that is Dr. Andrea Bassi. And you see the rationale for laser treatment in onychomycosis is based on 2 evidences. The first is selective photothermolysis. So the lighting of the target area determines a lysis with saving of surrounding structures. And a very interesting study of Uwe Pasch, my friend Uwe Pasch, that where we can see that the temperatures above 55 degrees are fungible, especially for the denaturation of the protein component of the membrane. So the heat of the light energy emitted by the laser reaches 80 degrees. The more sensitive among the dermatophytes is the rubrum. Why? Because we have the 2 main pigment, the xanthomenina, responsible for the red color that appears on the back of the colonies, and melanoid is expressed by, in particular, in a variety of trichophyton rubrum called precisely melanoides. In vitro studies documented that xanthomenina absorbs the wavelength of 532 and the melanoid pigment in 1064. The wavelength at 1064 absorbed by keratin is less than 30%, but enough to create a damage in thermal damage in the nail. This is the NPs, the traditional NPs with the focal distance that we have to take, shot by shot technique to cover the area that we'll see later on. And you see that there is sometimes a focal distance. You have to maintain the focal distance from the nail plate. And you see the very interesting test that we have done in the clinic. And you see that only around 40% of the energy is absorbed by the nail fragment and not recognized by the meter. So there is a great and important and meaningful absorption by the nail. And there is the very experiment in vitro. You see, there is inoculation first of the plate of 2 fragments of nail parasitoids, then irradiation after 24 hours after inoculation with different parameters, rating 15 days of any growth. And you can see that in this dish of Petri, the treated culture is white. So we see the modification and the inhibition of the growth. And you can compare the white with the red of the not treated colony. About the clinical treatment, you see, the treatment is characterized by 3 concentric movements from the center to the periphery and 3 vice versa for the total of 6 steps. These are a part of the onychomycosis that Dr. Bassi and all my team treated and experienced. You see, one type is subungual or dystrophic, can be lateral, different clinical appearance, but at the end, we can have the possibility to evaluate the good clinical results that we can get after carried out this kind of treatment. You see, the very dystrophic, but with good results. Well, it's very important to consider the procedures. Before each session, the patient was advised to hydrate the nail plate with an occlusive bandage with a 30% of urea. The interval between one laser session and the other was, in our experience, 15 days, proceeded by direct mycological crop examination. Maximum number of treatments, 7 sessions. After this term, patients whose clinical condition were stationary worsened, stopped laser treatment. Follow-up after 2 months from the end to the treatment with clinical objective examination and mycological tests. Parameters. You see here, spot size of 5 mm, 1 pulse length 5 milliseconds, fluence around 35 joule per square centimeter, and single shot. A cycle, 60 days, with 7 sessions every cycle. Well, in conclusion, let me quote Rox Anderson's statement, who has used to say that the rationale is that if I don't do it, someone else will. This is the new scientific method in medicine. Please, all of us, avoid this. We need to study national, international literature, should follow the proper scientific method to know the physics of our laser and light platform, to gain experience in our daily activity, and to share our knowledge and the acquisition of any kind of tricks in this activity, and share in all the events, congresses, courses, as we are doing today in the webinar, and we are used to do in the DEKA Academy in Italy and in other countries. So now I thank you all for being here. And now we move on in a question and answer session. Thank you.
That's great, Professor Bonan. Excellent speech and very in-detail explanation of what it concerning vascular application of our device in all the condition and all operating theaters we might find problem to solve under this standpoint. Now we proceed with a few questions that the audience has been sending throughout your explanations. I'd like to start, if you allow me to, from what we were saying about hair removal, okay? Many of the doctors, they were actually requiring more operative parameters for what it concerns actually darker skin types. So we are talking about skin type 4 to 6, and they are actually asking us some of the details on the parameters and the behavior to take for what it concerns patients like this. I would pass the words now to Dr. Michela Troiano, that earlier has been explaining to all the audience details about the hair removal, and I'll leave her space to give us the answer about this question. Please, doctor.
So for darker phototype, we need to reduce the fluence. So normally we work around 3.5 joules on centimeter square. We need to work always in a soft mode. We need to reduce even the dose. So normally we don't exceed 2,000 joules. These are as regard the parameters. Do you have another question?
Actually, Other questions that our audience is asking is about the maintenance to carry out after an hair removal course of treatment. What about this practice?
Okay, so normally we perform about 6-8 treatments. Then we start to increase the time between sessions. So personally, I don't pass to perform the treatment after 5 or 6 months. I prefer to follow the patient at the beginning after 3 months. Then I continue to increase until I can perform the treatment once, twice per year.
Okay, sounds great. So we slightly shift to Motus with Moveo PL handpiece now. Many of our audience here is asking about if these kind of treatment might be a result to be painful to patients or not.
No, normally they refer mild heating, but not pain. And we normally use an external cooling system and a gel. So normally they don't refer pain.
All right. And another interesting set of question is coming, showing up with saying if Motus with the Moveo PL is actually better than other technique results-wise.
Well, I think it's not the first choice for pigmentation. We have other devices. We have Q-switch, but I think it can be comparable to an IPL. So even what you can see after the treatment is pretty similar to an IPL. So it's great, but you need more session.
All right. All right. Some other questions are coming back again to hair removal and are asking, what about the behavior for the Motus user in case of 10 patients?
Of 10 patients? Well,
Yes.
I continue the treatment even in summer because always patients ask the treatment even in this period. I used to perform the treatment reducing the fluence in particular. So normally if I have a Caucasian patient and I normally treat with a fluence of 7-8 joules per centimeter square, I've reduced the fluence to 6. The dose, I maintain the dose around 2,500. Sometimes I've reduced to 2,000. I use a medium mode and not a high mode. This is for TANF patient.
All right. Another question that is close by relating to the topic is if you can share with us some tricks whenever we have to treat darker skin type patients.
So tricks for darker skin type. Well,
exactly.
We can treat darker phototype because thanks to the fact that we perform several passes into the same area, the treatment is also uniform. So we don't risk to create hypopigmentation. What is important to do when we treat darker phototype? Of course, we need to reduce the parameters, but what is important is to the speed of action. So we have to go very fast. We need an external cooling system if it's possible to be used, and we need to use always the soft mode. Another important thing, when we have to work in a bunny site, we have to be careful. We have not to insist too much, and we always have to ask to our patient what they feel. So if they feel burn, we have to go faster or stop the treatment. And what is really, really important is to shave very well, because a bad shaving can create burns.
Some other questions freshly came in now from user experience people that is actually is having a little bit of difficulty, doctor, in using the Motus in the lower and upper lip. Do you have any kind of shortcut to share with us?
Oh, well, personally, when I have to treat the face, I don't like to use a shaver. I prefer to cut in order not to make the hair stronger. We can perform the treatment using similar parameters, so 7 joules on centimeter square, and we can eventually, if you didn't have good results, you can increase the dose. But consider also the possibility to use the traditional MPs, because you have also the standard MPs. So if you are not really satisfied with the treatment in the treatment of the face with Moveo, you can shift to the traditional MPs.
Okay, now we are slightly moving to more in-vascular sets of questions. Let me just see that we are continuously receiving a lot of questions for our audience. So thank you so much, everyone. There are pretty many. And just before you leave us, doctor, just a couple of other questions about still hair removal. And the one is concerning how many procedures do we need to get to put in place to reduce hair on an upper lip section?
So on the up, I'm sorry.
How many sessions? How many sessions? Yes.
Okay, so in this case, we need first to reduce the interval between session. So I used to perform every month, and the treatment is longer. So we need more than 8 sessions sometimes.
Okay.
Because the presence of hair in the face, it's often due by the presence of hormones that increase the hair.
Very interesting. Thank you, madam. And a last question about the determination of the treatment area. Okay, so can you explain again to us how we might decide the amount of energy depending on the area we have to use the Motus in?
Okay, so the amount of energy is the dose that we need to irrigate in a square, which is for convention, is 10 by 10, but it's also our endpoint. So it means that when I treat this square of 10 by 10, my dose should be the dose necessary to provoke an erythema and perifollicular edema. So we can start with a test. We wait a few minutes, and then if the parameters, if the accumulated, the dose is right, we can proceed to treat the whole area. We can also increase eventually the square, but of course we need also to increase the dose.
Okay, and the last question concerning these group of topics, can you indicate us some tricks for the hair removal treatment to be more effective on face, especially when fair hair becomes a little bit coarser, a little bit thicker?
Well, first, we don't have to cut. This is an important point. I'm sorry, we don't have to shave. We prefer to cut with scissor. And then I used to increase a little bit the dose.
Very good. Very good, Dr. Michela Troiano. That's all by now. Thank you so much. And we are leaving room again to Professor Paolo Bonan for a brief set of questions on vascular implications. I have to say personally that the amount of questions we've been receiving today have been pretty remarkable. High level of the question, and especially the details that all of our audience has been declaring has been tremendously very high. So let's start with the vascular questions. Okay, all right. So Before we get into this, let me get you in the cooling time of the year, the cooler time of the year. One of the question is, can we treat vascular lesions in summertime or just in the cold season?
Sorry, there was no microphone before. Sorry. I really thank you for your question because it allowed me to answer about the difference between the hair removal treatment and vascular treatment. In hair removal, you can, if Dr. Michele Troiano confirms, even in June and sometime in July. I recommend to stop any kind of treatment, depends on the latitude and the country you are, but normally we stop before summer or very, very important heating by the sun in the summer, and we stop 1 month before. For example, we stop here any kind of laser treatment for telangiectasis, especially of the leg, in June, the first days of June. And we can try to have a sort of a rehearsal in the end of September to make a test, and then we can carry on. We can move on in fall. So it's better to stop, and especially at the end, I recommend cooling the skin, especially when we have a warmer weather. So cool and avoid, in order to avoid to cook the skin.
Okay, getting into the cooling system application. Here, another question is about how we are using external cooling system in combination with the contact cooling of the Moveo handpiece.
It's very important to put the contact cooling. It's not a contact cooling, is a cool hair that is we have to hold, or your assistant have to hold the Zimmer in a 45 degrees angle with the end piece. In the treatment of telangiectasis, we must, differently to the CO2, we must be vertical, holding the end piece and vertical on the surface during the treatment of telangiectasis, and release a lot of cool air during the treatment.
One double face question now. Can I use my new Moveo for genital skin depigmentation?
Depigmentation, right?
Yes.
Genital skin depigmentation, you mean this pigmentation in the sense
right.
of hyperpigmentation, right?
Actually, it's not specified on the question, but we might mean so.
Hopefully, the question is to treat the hyperpigmentation, because we don't have any success
right.
in the treatment of hypopigmentation with the Motus. Yes, especially in the Far East and in some areas of South America, there are a lot of studies on that. We tried to do this, and there is a contribution of my friend Pablo Gonzalez in South America that told me about the good success of Motus in the treatment by using Alexandrite in the treatment of hyperpigmentation of the genital area.
Okay. And
it's particular because we can cool down the skin thanks to the sapphire that we have in the tip of the end piece. So it's a very delicate area. So it's very not so painful treatment. You can use Motus even in this area.
Okay. A few of our guests are inquiring about what kind of gel or lotion to use during the Motus work.
Well, the gel is the common gel that we use in the ultrasonographic examinations. And so you can use that and for different reasons, but one of the reasons is just to move smoothly the NPs. So the common gel that you use in this kind of exam.
Okay, then I think by now we are almost set with questions. The time is almost up with the webinar, so let me say that. Let me thank you firstly, our guest speaker of today, Professor Paolo Bonan and Dr. Michela Troiano, and for what it concerns the remaining questions, you're kindly sent to us. They will be answered in the next following days by our guest speakers. Thank you for all the practice clues that you've been sharing with us today, all of your direction, all of your experience, all of your procedure that you've been putting at the disposal of anyone today. So thank you to all the participants today, to all the audience that have been so numerously participating to the event. Let me just thanks Mr. Vincenzo Di Miola for the precious and continuous assistance during the event. And for what I concern myself, goodbye everyone, and see you at the next webinar on Onda body shaping device sooner on this GoToWebinar channel. Thanks a lot.